Down payment. Taylor Kia's annual President's Day sale held over.
Uh-oh.
We're going to focus on your health here today on Ask the Expert, and we've got Dr. Judith Furlong joining us. Doctor, we're going to start with our first caller. They wanted to know, they said their doctor just told them that they had pancreatitis. I don't drink alcohol, they say. How did I get this?
Pancreatitis is an inflammation of the pancreas, which is an organ in your upper abdomen. It can be either an acute or a chronic problem and is associated with pain, nausea, and vomiting. 5 to 10% of patients will experience no pain. Although alcohol is one of the most common causes of pancreatitis, there are other contributing factors such as gallstones, certain medications, and high levels of triglycerides. Diseases such as Sjogren's syndrome can be associated with pancreatitis as well. In approximately 20% of patients, there is no known cause. Pancreatitis can also occur after certain procedures, such as an ERCP. A case of pancreatitis may range from mild to severe, and treatment may consist of fluids, lab work, and controlling the pain, nausea, and vomiting. Severe cases may require hospitalization. Talk with your PCP about a possible cause for your attack and ways to prevent a recurrence of your symptoms.
All right, another caller wanted to know from Dr. Furlong today, saying that I am expecting my first child. I am concerned because my husband has a nephew with autism and was told that it can run in families. I don't know much about it, and I would like to know more. How common is it, and what exactly, can you just define autism for this person?
Autism spectrum disorder is a term given to a group of developmental disorders affecting how a person behaves and relates to others. The exact cause is not known. Some affected individuals may have only a few symptoms that are mild. Others can be disabled due to the severity of their symptoms. Autism spectrum disorder can affect between 2 and 20 children per 1,000, and it affects boys more often than girls. 4 to 7% of children with ASD have an affected sibling, although the risk may be higher. Children are not frequently diagnosed until they're over 4 years of age, but early diagnosis and intervention is very important. Become familiar with the signs of autism spectrum disorder, some of which include avoiding eye contact or preferring not to be held or cuddled, repeating the same actions over and over, and having trouble adjusting when a routine changes. Communicate any concerns to your child's PCP. They may wish to do further evaluation or screening to determine whether there are other factors contributing to your child's behavior, such as hearing impairment or exposure to lead or other toxins. Although autism spectrum disorder cannot be cured, early intervention can help to maximize a child's potential.
All right, finally today, caller says, help, I think I have a colicky baby. What am I doing wrong? Am I causing the colic? Will it ever stop? And should the baby be tested for all of this?
Colic generally occurs in the first 3 months of life, and you may not be doing anything wrong. Babies with colic tend to have a loud, high-pitched cry that is not easily consolable. The crying may last more than 3 hours a day, and it tends to occur in the evening. It can come on very suddenly. Other signs of colic are arching of the back, stiffening of the arms, and having a very firm abdomen. A warm bath, gentle massage of baby's belly, or a car ride can help to stop the crying. Preventing baby from swallowing too much air while feeding and feeding with baby sitting up may also help. Contact the baby's PCP if there is nonstop crying for 2 or more hours, if the infant is under 3 months of age with a fever, is refusing to eat or drink, is vomiting, having bloody bowel movements, or is not acting normally. Although there is no test for colic, it usually resolves on its own by the time baby is 3 to 4 months old.
All right, I know it can be frustrating for parents. Doctor, thank you so much. We appreciate it. Coming up tomorrow on Ask the Expert, legal matters. A lawyer will be here answering your questions. WTVG.news. It is correct. News at 13abc.com is the place to send your emails. Oh, old habits die hard.